Good day, everyone, and welcome to the Foundation for a Healthy Kentucky Planning for Success webinar. Today's conference is being recorded, and at this time, I'd like to turn the call over to Rochelle Seeger. Please go ahead, ma'am.
Thank you so much. Welcome, everyone. So glad you joined us today on this Health for a Change webinar. My name is Rochelle Seeger. I work here at the Foundation for a Healthy Kentucky as a Community Health Research Officer. I'm honored to work in that role on the Foundation's data initiatives and this training series, Health for a Change. Hopefully you have some people on the call who this may be your first time joining us, and I'm so glad you're here with us today. First, I'll give a couple of pieces of information about the Foundation for a Healthy Kentucky and this training series, and then I'll turn it over to our great keynote speakers that I've brought to you this morning. The Foundation for a Healthy Kentucky was founded in 2001. It's a nonprofit philanthropic organization created from assets with a settlement between Anthem Blue Cross and Kentucky Blue Cross and Blue Shield. Our mission is to address the unmet health needs of Kentuckians, and we do that through a number of ways. We do that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. I'm excited to work on this training series that we call Health for a Change. It was started in 2011 to share resources and information with Kentucky's nonprofits so that all of us can work to build our capacity to make health improvements across our state. The website there at the top is where all of our Health for a Change webinars are archived, and you can also see the upcoming schedule, which you won't want to miss because we have some great things coming up for you the remainder of 2018. Next month we'll have a health equity webinar. August 1, I'm excited to hear from Kentucky Department for Public Health and the Kentucky Bounce Coalition talking about adverse childhood experiences. You can see our other great webinars and workshops upcoming for the upcoming months we have here. Upcoming, mark your schedules, people. Also in September we'll be at the Foundation for Healthy Kentucky's BOSE Health Policy Forum. It will be held in Lexington, and all of you on the call will be glad to know that the registration has just opened for that event. Almost every year that event sells out, so if you want to join us in Lexington for the Memorial Health Policy Forum, please log in at regonline.com/BOSE2018 where you can register. And here's the Foundation's social media. I tweet out of Kentucky Health Facts, and here's the data website that the Foundation put up, kentuckyhealthfacts.org. So welcome to check those out, and I'm happy to answer any questions about that. The Foundation tweets out of Healthy KY, and the Foundation for Healthy Kentucky has a Facebook page. I'm thrilled to bring two great speakers who have a lot of experience in community planning, strategic planning, and I'm thrilled to turn over the call to Amanda Silver, who will be talking about her work and give us some guidance on strategic planning. Amanda, welcome.
Thank you so much, Rochelle. Hi, everybody. I hope that you're doing well and having a good early afternoon. I am going to talk a little bit about strategic planning, and the outcomes for my piece are first, to review key elements of strategic planning. Second, to give you a chance to assess your strategic planning readiness. And then third, to identify common barriers and best practices for strategic thinking. And I want to thank everybody for writing in as part of your registration some of the things that you struggle with related to strategic planning. We're going to address some of those. And I want to start with this great cartoon. So what is strategic planning anyway, right? So most people, when I say strategic planning, start to roll their eyes, and I hear many stories about folks thinking that strategic planning is just kind of a drag. And here we have this cartoon where you see two people saying, we're ready to begin the next phase of keeping things exactly the way they are. So strategic planning is not that. When it's done well, that is what strategic planning is not. And that's what I want to talk about today. I want to kind of reframe strategic planning so we walk out of here feeling excited and energized about the possibilities of doing it. So our working definition for strategic planning is that it is a systematic process by which an organization agrees on and builds commitment among key stakeholders on priorities that are essential to the mission and responsive to the organization's environment. And the key words here that I really want to emphasize are that it's a systematic process. So there's a series of steps that we utilize to employ strategic planning. If it's done well, strategic planning actually helps to build commitment and alignment among all of the people who are engaged with your organization, your staff, your board, your executive leaders, and perhaps the people that you serve as well, so your key stakeholders. And that the core thing behind strategic planning is to identify and choose key priorities that are essential to the mission and also related to and responsive to the environment in which your organization is working. So when done well, strategic planning is an incredible opportunity to build alignment, to get clear on the directions that you're going towards as an organization, and to invest in engaging all of your stakeholders in an interactive opportunity to talk about hopes and dreams and aspirations for an organization. So here are some of and I think really at the heart of strategic planning, what it helps to do is draw an organization's kind of current state, which may be around confusion. Like a lot of us in our organizations have so many priorities. There are so many pressing demands and needs. There are clearly so many client needs that we want to fulfill that we try to do everything, and we end up not being successful on everything because of that. So strategic planning helps move us from confusion to a sense of clarity. It actually helps us align and prioritize what we are working on and also what we are not working on. So it creates a set of, the process itself creates a set of criteria that helps us actually with confidence say, we are not going to do this, even though it's a great opportunity and someone should be doing it. We are not going to do that because our 5 core priorities are these. And a strategic planning process will give an organization and leadership the confidence to be able to do that well. So here are some of the other benefits I want to mention briefly. Creating clarity, getting everybody on the same page, getting out of the weeds to see the big picture vision and long-term goals for an organization. We know, because I work solely with nonprofits and social change organizations, it is so easy because the demands are so strong and the need is great. It is so easy to just move from one urgent item to another and not take the time to get out of the weeds and see the big picture around where are we going over the long term. Strategic planning allows us to do that. Related to that is being proactive instead of reactive, and identifying actions and steps to grow, both to grow as an organization, also to grow one's funding base potentially and resource base, and identifying where staff are needed and where staff are not needed. And then finally, strategic planning really allows us to assess the current trends and the landscape affecting our organizations. So I want to give us a chance to really think about strategic planning readiness, because while it is very, very important and it's so valuable, it's not necessarily for every organization there's an element of readiness that's really important. And I'm sure all of us can think of either circumstances or situations in which we were part of a strategic planning process, or we know somebody who was part of a strategic planning process in which a lot of time, energy, resources were spent, and at the end of the day, nobody actually knows where the strategic plan is, or even better, it's in a big binder gathering dust on somebody's shelf with nobody looking at it. So that would be an example of a strategic planning process that I would say did not go very well. And usually the reason that we end up with those kinds of outcomes in strategic planning is because we haven't taken the time up front to really reckon with ourselves as organizations and leaders and identify, are we ready or not? So I'm going to go through this list right here on this slide, and I want you, if you have a pen and a piece of paper nearby, to just write yes or no if these statements apply to you and your organization at this point in time. So the first is, there is support for planning on the leadership, staff, and board levels for strategic planning. So write yes or no at this given moment in time. And what I would say about that is that ideally we want support for planning on all three levels. However, if we know that there is not support for planning on the leadership level, then it's going to be very difficult to move strategic planning forward. So staff and board, if we have mediocre support or halfway support or not a ton of support, we can sometimes work with that. But if we do not have support from the leadership level, strategic planning process is not going to get very far. And if it does move forward, it's not going to be very productive from my experience. The second statement, we can identify a staff or board member who will serve as a leader for the strategic planning process. So again, write yes or no. And this is important because strategic planning is not actually, when done well, it's not something that is, when done at its best, a staff person and resources are set aside with the understanding that it's for a temporary period of time. That is a crucial element of the work of the organization. It's not in addition to everything that's already happening. It's actually something that is up front and center as a project that needs to happen, just the way you would identify and work on a service project for clients. So we want to make sure we can identify a staff or board member, or in some cases 2 people, who will serve as the leaders for the process and really champion it and move it forward. The third, our leaders can invest the time in strategic planning without creating a negative impact on ongoing operations. So again, write yes or no. Our funders or supporters have been asking us about our long-term plan. Are you ready? Is this true for you or not right now? I would no longer consider our organization in the startup phase. Is this true for your organization, yes or no? We are financially stable enough that the majority of our time is not spent keeping the doors to the organization open. Again, is this true for your organization at this time, yes or no? And then finally, we could be doing more in our community. The need for our services is greater than we are currently providing. Is this true for your organization, yes or no? I want to just go back for a second and say, strategic planning readiness, this is a question I always ask potential clients, has a lot to do with, sometimes people reach out to me because they are in dire financial straits and they want to create a strategic plan to build their donor base. And my response 99% of the time is actually that it's not a good time to begin strategic planning. You really need to shore up finances so that you have some solvency for 6 to 12 months in advance, because the urgency of finding funding for the organization so you could keep the doors open will get in the way of being able to do the long-term visioning and planning that strategic planning necessitates. which doesn't mean you can't be strategic about the choices you make while you're working on that. But it is probably not the right time to begin strategic planning. Okay, so now count up your yeses and your nos. Take a look at that. And here's what I would say about this assessment. If you can answer yes to all of these, then you are for sure ready and can dive into strategic planning. If you have 1 to 2 no's, you are very well on your way, but you're going to want to consider those no's and very carefully look at how you can move those no's towards yeses before you engage in strategic planning. Or as a part of the strategic planning process, you're going to want to actually build in steps to the process that will help move those no's to yeses. And then finally, if you have more than 2 no's in this list, you are, I would say, not ready to begin or jump into strategic planning. Your focus should really be on building the support and the infrastructure that you will need to do this well. And again, I would say this doesn't mean that you cannot immediately begin to employ strategic thinking and work towards what a strategic planning process would look like, but you don't want to actually engage in a strategic planning, a full-blown strategic planning process. So I've talked a little bit about some of the conditions that are really necessary for strategic planning to be successful. I want to briefly talk about the elements of, what is a strategic plan? So I'm just going to gloss through this pretty quickly. And what we see here is, a traditional, and I say traditional strategic planning process because some processes, you may have some elements of these already in place and you don't need to engage with them. But in a traditional strategic planning process, kind of the full-blown process, you are going to be doing work on each of these elements, refining or clarifying or developing your mission statement, identifying your vision, an inspiring statement of where you intend to be in the future as an organization, clarifying your core values, identifying the priorities or the strategies, those core directions that you are going to be focusing on to accomplish your vision and meet your mission statement. And then underneath those priorities, identifying very clear goals, usually 1, 2, and 3-year goals for how to achieve the strategies. You're going to be looking at what are the resources necessary to meet the goals and the strategies. And then you're going to be diving into an implementation plan that is much more of an operational plan that includes the timeline, the responsibilities, the structure for implementation. And then finally, as a result, and in addition, you want to crystallize the criteria that you're going to use for deciding on new opportunities, because we all know that we live in a very dynamic, fast-paced environment, all kinds of things, trends changing, and so you are likely going to be faced, even in the best strategic planning process, you are likely going to be faced with new opportunities or trends that confront you while you're in the middle of implementing your strategic plan. So identifying as part of the process what the criteria are that will be important to consider for deciding on new opportunities is a valuable part of the strategic planning process. So we talked about some barriers. I want to just name a couple of the other ones that you came up with when you wrote into your registration. These were the 4 most common barriers. One was short-sightedness, urgency of the new. I heard from many of you saying, we're so focused on the day-to-day, it's really hard to pull back and look at the bigger picture. And the second was we don't know how to engage our community stakeholders, or there's some apathy from our community stakeholders into strategic planning or wanting to actually invest in it. Time, money, and staffing surface quite a bit. We don't have enough time, we don't have enough money, we don't have the right staff in place to do this. And then the fourth one was using data to drive strategy and not knowing where to get the data from or how to employ it in a way that was going to be useful. So I'm just going to offer short pieces for each of these things, and you'll be hearing more from my colleague Sarah as she talks about her presentation. But on the short-sightedness, urgency of the new versus taking the time to look at the long-term visioning, I will say unfortunately there are no easy fixes for any of these, but here's what I have seen work well, and when things have worked well and organizations have turned things around, this is what I have seen work. So around short-sightedness and urgency of the new, I would say one way that organizations get past this is by appropriately planning a strategic planning process that is going to meet the time needs of the organization, right? And so you don't want to shortchange the elements of strategic planning, but a good strategic planning consultant will help design a process that will get the most done in the shortest amount of time. The second piece I would say about that is that even with that, it really is a mindset shift, and it's a valuable mindset shift that needs to happen for the leadership of the organization. Because if you're always in a reactionary mode, it will be difficult to get to where you want to be in terms of your long-term vision. So strategic planning is a great opportunity to start practicing that. Engaging community stakeholders. If people aren't bought in, there are so many ways to design a strategic planning process that will actually invite people to offer their input, feedback, what they care about, what their aspirations are for the organization, what things could be. And a fantastic way to engage people around that is to invite people to offer their hopes and aspirations and dreams for what their vision is for the organization. And that works for whether it's a community member, a customer or a client, or a board member. And one of the ways where I've seen this work really well is when groups invest the time and energy to do a set of house meetings or one-on-one conversations with community members, or pull together a cross-section of all the different folks that they are that are in the universe of the organization, and do a half day or a 2-hour or a 3-hour visioning session and really engage everybody in coming up with new ideas for where the organization wants to be. So time, money, and staffing. I have found that folks, when they get really serious about strategic planning, are sometimes able to find funding specific to strategic planning, either from foundations that help to invest in capacity building, or pitching and making a case to particular donors and people who are invested in the organization's success. And then as much as what I would say on staffing is that it is really essential to find at least one person who's going to champion a strategic planning process. And so figuring out how to identify that is really important. And then finally, data, using data to drive strategy is, I think what I would say about that, one of the things that often surfaces in the groups that I talk with is that they feel like it costs a lot of money to collect data to help their strategic planning processes. And what I would say is that, yes, certainly if you hire somebody to develop surveys and whatnot, but there is so much data that you can collect, and I've seen groups do very successfully on their own through qualitative one-on-ones, house meetings, and also using surveys through SurveyMonkey or internal, even Google. There's so many tools now that help people develop surveys that you can start small and start to build that in, and not to expect that you need the largest amount of data to inform your strategic planning process. So those are some of the key pointers that I would address for strategic planning. I will share one last thing, which is a couple of resources that I find very valuable. And I'm just looking for that slide. Rochelle, are you able to skip to the resources slide? Great, thank you so much. So 2 resources that I would offer to this group. One is Nonprofit Strategy Revolution, Real-Time Strategic Planning in Rapid Response World. This is a fantastic book if you are not quite ready for strategic planning, but you want to identify more strategic thinking and introduce more strategic thinking into your organization. This is a book that has a whole set of tools and worksheets that will help you work through different and important strategic questions that you can pose without doing the full-blown strategic planning process. And then the second resource I would offer is Strategic Planning for Nonprofit Organizations, which is a real guidepost for anyone planning to embark in a larger strategic planning process. Thank you so much. I'm happy to address any burning questions that people have. I also know that Sarah is going to be presenting on some additional strategic planning resources and examples. So I'm going to turn it over to Sarah unless there are any specific or burning questions related to what I just shared.
Thanks, Amanda. This is Rochelle. Everyone, I just want to remind you that we welcome your questions. Chat those in on the chat box. Also a reminder that the slide decks will be posted to the Foundation's webinar. So if you didn't get all of the information or the schedule of Health for a Change, that will be ready for you. Thanks so much, Amanda. Glad to turn the call over now to Sarah Walsh. Go ahead, Sarah.
Oh, thank you. Yeah, Amanda just skipped right over her own closing slide. So I'm going to just put this up here again because that was short-sighted of her. This is a complicated and challenging process. And if you have the resources or the opportunity, I think a good piece of takeaway advice here is call Amanda. She does this for a living. And that's an advantage that I think more of us should take advantage of. Did I say that right? Anyway. Or this is me. I am a little bit less useful, but I am a former Foundation for a Healthy Kentucky employee, and I'm currently working as an associate professor at Eastern Michigan University. And I'm hoping that my part of this conversation can sort of pick up where Amanda left off and help you guys connect better and put this into practice at your own organizations. Specifically, if you went to the Health for a Change website and you were looking at the learning objectives, I think my piece of this process is to really introduce you to the MAPP process, which some of you may already be familiar with if you work at a local health department, and really draw some connections and similarities between that process and other common strategic planning models. That's what I'm supposed to do. Full disclosure, I'm probably going to go rogue a little bit here. What I hope the takeaways from this part of the conversation is really strategic planning matters. Everybody is doing it. Even if we're not talking about it in the same way, all of your organizational partners are engaged in some form of strategic planning. And we can do more when we get on the same page and are rowing in the same direction. So because this is the part of the afternoon where I usually have my slump, I'm going to make everybody push some buttons on their computer screen just to wake you up a little bit. Plus I heard there was poll technology, and that's fun for me. Quick question for all of you. If your organization experienced a significant budget shortfall, you would know what services to cut. Are you very confident you could do that, somewhat confident, a little bit apprehensive, or, oh God, no, please don't cut our budget? I'll give you guys a couple minutes to answer here. All right, that seems to be most folks coming in here. So I'm very impressed that you are confident that if you needed to draw back your services, you would know what cuts to make in the things your organization is doing. And that is dark and depressing, and I'm not a big fan of that terrible scenario. But I've lived that terrible scenario, as I'm sure many of you did as well. I was an employee at the foundation during the Great Recession, and one of the things we did was really lean on our mission, vision, and core values, those components of our strategic plan, because we suddenly had a lot less money to allocate for grants and the services that we planned on. So we needed to rethink some aspects of our strategic plan and how we were going to execute it. But because we had that foundation, we were able to sort of stay the course and continue to work towards our mission. Personally, I like happier scenarios. I don't know if any of you all were involved in this. This is my current university in 2014 when university administrators, and you can see the mascot up at the top looking completely sinister, participated in the Ice Bucket Challenge. This was some complete nonsense of people pouring ice water on their heads that went viral on social media. And out of nowhere, the ALS Association received $115 million from this summer campaign started by someone who was passionate about their cause. And for the ALS Association, their annual budget is typically about $20 million, which sounds like a lot, until someone gives you a check for $115 million. And then all of a sudden, you really have to rethink what you've been doing and shift gears. It helps to have a strategic plan of what to do in that scenario. And this is not my political slide. This is my the money fairy does sometimes come up, and hopefully this will be something that can happen at your organizations. I don't know if you've seen this recently on social media, but the Wilner family set up a Facebook fundraiser to try and get $2,500 for an organization they believed in called Races. Races' typical annual budget is about $7 million. And in just a couple of weeks, they've raised more than $20 million at last count, just through Facebook. They've had additional donations coming in through other platforms. So this has really been a we need to be ready scenario. Just in case something goes on, we need to make sure that we are ready for new opportunities when they present themselves. Okay, I hear some people are having a little bit of difficulty hearing, so we'll see if we can do this a little bit better. But I have another poll for you guys. This one doesn't look like it's powered, so maybe this is more of a rhetorical question for you all. I've got room in my schedule to volunteer to attend monthly planning meetings for an organizational partner. I would just love to go to more meetings. Yes, please, sign me up. Is that an option that anybody would be selecting? Even though you can't click on it, I'm trusting that no one would choose that scenario because we're all busy people. We all have a lot of different things going on. So it's really critical that we're talking about these in a way that by developing some shared language around planning, we can identify mutual benefit. Because if you're asking someone to come to your meetings to participate on your planning team, that's a pretty big ask. And how to help, even though we're all committed to the same cause, we need to make it clear that this is a good use of your workday. And the reality is that there are a lot of different models out there for engaging in strategic planning. The truth is they all have the same fundamental concepts that Amanda described earlier. We're going to explore trends, see what's happening, look at the data that's available without going crazy on the data that's available, put together a plan, and then live with that plan, which means we really need to evaluate new information and opportunities when they present themselves, just in case the money fairy shows up at our door. And unfortunately, because we're all using different planning models, we end up in different silos a lot of the time. And we work on our different planning, and we're all doing very similar work just because different models get used in different sectors. But I really believe that these silos are built out of jargon and not out of substance. We are doing very similar work, and there's a way to make that come together. So I'm going to start with the goals at local health departments. When I saw the registration list, it seemed like that might be kind of where the majority of folks come from, or at least a solid minority. So let's think about our individual and shared goals so we can get out of those silos. With health departments, it's really, the conversation is increasingly about accreditation. Even though public health department accreditation is not a required activity the way it is for some other clinical organizations, it is strongly encouraged. And in order to get there, health departments need to submit a community health assessment, a community health improvement plan, and a department strategic plan. Those first two, and then there is a lot of supporting documentation. I don't want to make this sound easier than it is. There's a lot of supporting documentation that goes in. But those first two ideas, that community health assessment and the community health improvement plan, I want to make sure that we're mindful of those. And I want to just pause and note that y'all are killing it. Kentucky is honestly leading the nation in public health accreditation. This is a big deal. My current state of Michigan, I'll tell you, we have twice as many people. We are a little more than twice as big as y'all, and we have half as many accredited health departments. We have just been blown away by what's been happening in Kentucky. And even in doing that, the Public Health Accreditation Board does not care. They do not care what planning model health departments use. Even so, MAPP is a common one. MAPP stands for Mobilizing for Action Through Planning and Partnerships, because if I know one thing about public health, it's that we love acronyms. And the advantage is that they have this sort of visual roadmap for what the process is, because who doesn't love a good MAPP pun? Really? MAPP puns are the best. But the reason everyone is really using MAPP, aside from the puns, it's a little bit the puns, it's more so because of the robust technical assistance that's available. There are a ton of resources available from NACCHO to really walk you through how to do MAPP in your community. And the overarching premise is that MAPP is a health department-led activity, generally speaking, and it really emphasizes community engagement and coalition building. When you're done with MAPP, and you're never really done, when you work through MAPP, you are going to meet those requirements for FAB of having your community health assessment ready and your health improvement plan ready to go. That's sort of the end game of what you're going through MAPP to achieve. This is not the process you're going to use for that internal health department strategic plan or internal organizational change. This is about making your community a healthier place to live. There's another presentation of the MAPP model that I think is a little bit easier to follow. So while I appreciate the roadmap, I prefer this one. And there's a lot of parallels here between the steps that Amanda outlined and what MAPP is asking you to do. It begins with this idea of organizing for success, developing partnerships, and identifying a shared vision. Getting your team together, getting everybody on the same page, that is really the starting point that Amanda presented as well. Having a mission, a vision, core values. We need to figure out what a healthy community is going to look like in our community. This is followed by the 4 MAPP assessments. So I'm going down the center of the circle here, and the 4 MAPP assessments they recommend are on the outside of the circle. They recommend you review community themes and strengths, what's going right in your community. Assessing the local public health system. This is a lot like the readiness challenge that Amanda presented earlier. Looking at community health status. How healthy is your community? What are the outstanding challenges? Shameless plug, Kentucky Health Facts can help a lot with that particular piece. And then a forces of change assessment. So really identifying what are the trends that are coming and going, what opportunities might present themselves. That's, again, another piece that Amanda alluded to earlier. It's slightly different packaging, but it's the same exact process. Once you get there, we continue in those key steps of identifying strategic issues, coming up with what your goals are going to be and strategies for achieving those goals. And then there's this cycle of events at the bottom of planning, implementing, and evaluating. This action cycle is where you're living with your plan. It gives you the chance to respond to new opportunities, to respond to changes in the resources that are available, to make mid-course corrections along the way if your strategies aren't going exactly the way you thought they would. Some key strengths with MAPP, what I really love about this particular model is that it is very clear and explicit, particularly with all of the technical assistance that's available, exactly what it is you need to do. And it's incredibly thorough based on following this guidance, doing the 4 assessments, really thinking through all of the different dimensions of your community. You're going to have a very thorough plan for making your community a healthier place to live. An honest limitation of this plan is that the first time through the cycle, it goes very slowly. This is a huge undertaking for a community, and that can be a challenge, particularly when you start working with other partners. For example, when we think about what the goals of our colleagues at nonprofit hospitals are, we may see things a little bit different. To be a little bit of a cliche, with charitable hospitals, there has been this long-standing bargain with the government that as a nonprofit organization, the federal government is foregoing the tax dollars that they would otherwise receive from that organization. And in order to be tax exempt, in order to be a charitable hospital, the IRS expects you to provide a benefit to the community. So that piece isn't new. That's always been the agreement. What we saw was that the reporting standards weren't very clear. And when we'd get community benefit reports, frequently hospitals would emphasize the amount of uncompensated care they provided to a community. So the number of people who received clinical care and didn't have insurance to pay for it weren't able to pay out of pocket. If you look at this pie chart from this hospital that shall remain anonymous, the biggest chunk of the pie as they're trying to identify their community benefit is that teal color is uncompensated care, so charitable care that they provided. When the Affordable Care Act passed, the idea was, and obviously as we've lived with the law, things have ebbed and flowed and changed a little bit, but the idea was to increase the number of people who had health insurance. So we would reduce the need for uncompensated care from our hospitals. And if that was going to transpire, we needed another way for hospitals to display and to demonstrate that they were providing a community benefit. So there were new rules added for nonprofit hospitals. I got to be honest, they are still pretty vague, but they need to provide a community health needs assessment and an implementation strategy for addressing that need. And if that sounds familiar, it's because it's exactly what health departments are being asked to produce. There's some other stuff in there that was about charges and billing, and we don't care about that. The key part here is that hospitals and health departments have exactly the same expectations. The specific rules that the IRS laid down were, they said you need to have the broad interests of the public represented. That doesn't necessarily mean hospitals are obligated to have the same team of stakeholders that a health department might otherwise bring together, but it can't hurt. The IRS said and the law said you needed to have input from public health experts, so they need to have public health at the table. But it's, again, open to interpretation how they go about doing that. The law says they need to make their plan widely available. This has sort of been universally accepted to mean put it on your website. We'll give them that one. You need to have an implementation plan. It's not enough to just describe the problems in your community. You need to do something about it. And hospitals need to repeat this every 3 years. And that can be the key consideration and the key challenge of partnering with colleagues on a MAPP cycle. That once you've been doing MAPP in your community for a while, that's no big deal, but meeting that initial 3-year deadline could have been difficult. Now that this law has been in place for a while, this may be a time and an opportunity to join forces and synchronize watches with our colleagues at local hospitals if you've not done that before. Taking a look at some of the other partners and other sectors that are out there. Again, they may have their own language and jargon, but often very similar goals. A pretty common model we'll see is called Plan, Do, Check, Act. This is often used for individual project grants. You'll see it in RFPs sometimes. But this is exactly the Plan, Implement, Evaluate cycle from MAPP. It's different words. It's the exact same process. And the emphasis here is really on project evaluation and continuous quality improvement more than building that foundation that MAPP provides, or that, as Amanda was saying, is really the foundation of what a strategic plan is for. But once you have that, if this is the language that appeals to your partner, there's absolutely no reason not to use it. Similarly, if you have continuous quality improvement folks, this is the process that's used by people who pursue Lean Six Sigma management strategies. So if you've got some folks with their MBA on your team, they're going to speak this language. But again, once you have your mission, your vision, your core values, the strategies you've set up for yourself, this is really just a tool for developing and refining your implementation plan. There's no reason you can't adopt this language if it makes your partners happy. If you're working with folks in the for-profit sector, or again, just more MBAs, this is going to be how their training came about. It's a little bit more elaborate than just continuous quality improvement, but people who are used to preparing business plans, it's just another way of framing these same discussions about strategic issues. One of the advantages of a business plan is that it is a very concise document. They are very well trained to make these short and sweet and to the point. And telling your story efficiently is a lesson that we should probably take across all sectors. And business plans also include financial projections that really, businesses are about emphasizing profits. But as nonprofit organizations or health departments or hospitals, if we're doing new work to address our community's health needs, that conversation around viability and sustainability that comes with these financial projections can be really beneficial, making sure that after a grant ends, we're able to continue our good work. One more poll for you guys. So I think I could find some common ground with an organizational partner who was using a different approach to strategic planning. Just to get you awake and clicking buttons again. Do you think that if you were working with someone from a different sector, you could find some common ground in your planning process? Are you confident you could do that? Somewhat confident? A little apprehensive? Or, oh dear God, no, please don't make me talk to anybody. Give you just a few moments to respond and chime in here. And I think that's awesome. For the most part, we're feeling confident or even very confident in some cases. Those of you who are somewhat apprehensive, it's really not as scary as it needs to be. I hope that you would feel comfortable just kind of going back, Googling the images that are associated with your partner's or your colleague's planning model and finding some of that common ground. Because the reality is, whether you're starting with MAPP or you're starting with any other model, developing those partnerships is really the critical first step. That's the end of my spiel, so I'm going to hand it back to Rochelle now for...
Thanks, Sarah. What I'd love to do is everyone on the call, we think about this process, and sometimes what comes to the front of the mind is those challenges and barriers. But I know, I imagine that most of us on the call have participated in this in some way. I would love for everyone to chat in their favorite idea or something that's worked really well for their strategic planning, whatever strategy that you used. I would love to hear some of those success stories and share those. And Amanda and Sarah, I'll ask you to share your favorites as well. I'll begin. I have two favorites. One is just what we see on the slide here as a community member. When I engage in community planning with my neighbors, or I've engaged in it, I love to go to those meetings and to hear everyone that's around the table introduce themselves and introduce the organization they may be representing, because it's a great opportunity for me as a community member not only to contribute to the planning in my community, but also meet others who are working in the neighborhood who I may not know, and I may not know what those resources are available. So that's one of my favorites. My second favorite, I'm going to call out Green River District Health Department, because I saw them present on their strategic planning process. And what they did was precisely not keep their community health needs assessment on the shelf. They published that. They brought it out to the community. And what they did was open it up for community dialogue. So the community came back and a group said, hey, we aren't really included here. Have you considered XYZ? And what they did was keep that document off the shelf, and they went back and made revisions to their community health needs assessment. So for me, those are two really exciting examples. Amanda, do you want to share an example of
thanks.
Yeah, go ahead.
Yeah, sure, Rochelle. One of my favorite projects that I worked with was for a Centers for Health and Aging, which had 3 different arms. One was Aging Resource Center for local neighborhood members. One was a research arm, and one was a capacity building arm to train health practitioners in the field to be doing their work in a different way. And the organization called me in for strategic planning, and after doing a little bit of one-on-one interviews with folks, it became very clear that all 3 of those different programs had no clue what the other programs were doing. They were very siloed and really could not understand how their work was all related to the larger whole. And so the success was that we brought everybody together, about 50 staff people from 3 different programs, for a day of visioning and looking at the mission of the organization. And it was a total win, because people were talking to each other about their work in ways that they had never done before. And through doing mission and vision alignment work, where everybody got on the same page related to what they were trying to do, they started to really think about new ways that they could work across their programs and support each other. And they've continued to do that. So that's a huge win.
Sarah, chime in with one of your favorites.
Sure. I guess one that comes to mind immediately is I work with my local affiliate for Meals on Wheels here in Michigan. And we were working on their strategic plan. And one of the things that kind of happened around the room is people were bouncing around all of these exciting ideas, or you'd see a new grant opportunity that someone might pursue, and there was this sort of wacky tangent of how wonderful would it be to open a community kitchen where people could make foods that they could sell at the farmer's market, and we could provide this resource and this service in our community. And kind of all at once, because they'd put in the work and they had a strong vision and they had a strong sense of their organization's mission, the group was able to pull that back and say, wait a second, we're Meals on Wheels. Our purpose is to provide daily meals to homebound individuals in our community, and we can't do these other things if they're going to get in the way of our core mission. So sometimes it's saying no to the there's a $500,000 grant opportunity. We should go get the $500,000. And we shouldn't, because it would take us away and draw our focus away from the thing that we're supposed to be doing every day. So it was exciting to see them lean on their strategic plan and lean on that foundation that they built for themselves to avoid scope creep, as it's sometimes called.
Thanks, Sarah. As we wrap up today's call, I want to thank all of the participants for being on the call today, for planning for success, MAPP strategy, decision making, and health. It's an honor to have you all on this call. Especially thank you to our two presenters, Sarah Walsh and Amanda Silver. I appreciate you sharing your experiences with us. Again, I coordinate this training for Foundation for Healthy Kentucky. Here are some upcoming training opportunities. And it's important for me that I'm serving you. So how can I be of help? Are there ideas for trainings that you or your community could need? I welcome your ideas. And one way you could do that is by giving feedback to us. I'll send a link to the post-event survey. It's a SurveyMonkey link that takes about 3 minutes to complete. That'll be in your email. And I would love to hear feedback on this event, your ideas for other events in our community, and how this training series, Health for a Change, can be of help to improve health in Kentucky overall. Again, the Foundation's website is here. The slide deck from today's webinar will be posted there, and also a recording of the webinar will be posted. Again, I appreciate all of you for being on the call today. An honor to be serving you and helping to improve health overall in Kentucky. Thanks so much. I hope you all have a great afternoon.